Hi, this is Dr. Simon Fung. Now, we have all heard or seen the message that addiction is a disease. However, many people do not agree that addiction is a disease. The most common pushback I hear is that no, addiction is just a choice. In this video, I would like to explore the notion of addiction as a choice. Now, it seems pretty obvious that drug and alcohol use involves a decision to use. Just as people choose other behaviors such as having unprotected sex, dropping out of school early, or hanging around people that our parents warned us about. These poor choices can lead to detrimental outcomes, such as unwanted pregnancies or sexually transmitted diseases, or dead-end jobs, or a life of crime and incarcerations. But surely we can't label all these bad outcomes as diseases too, can we? Now, those who believe that addiction is a choice outline clear differences between diseases and choices. First of all, free will exists with choices, whereas diseases do not engage free will. We are responsible for our choices, but not for our diseases. Also, coercions and punishments can influence our choices. For instance, someone facing incarceration for repeated drunk driving charges might stop drinking. On the other hand, no incentive for punishment can keep a person with pneumonia from developing a fever. With choices, we select behaviors and face the consequences, whereas diseases are characterized by symptoms over which we have absolutely no control. All this seems pretty clear, doesn't it? However, once we attribute addiction to choice, it becomes very easy to look at addiction through the lens of morality and religion. Bad choices are seen as immoral. Seeing addiction as immoral leads in no small measure to the stigma associated with addiction. But let's look at this choice thing a little bit closer. Actually, it turns out that patient choices and behaviors play very strong roles in practically everything that we treat in medicine. Obviously, smoking, overeating, and lack of physical activity are behavioral choices, but are also major contributors to heart disease, strokes, and diabetes. Athletes may choose to play football despite being aware of the risk of concussions. The police officer or soldier who gets shot in the line of duty can also be said to have chosen the job, fully aware of the risks. There are also choices of inaction. A patient might choose not to fill an expensive prescription because she cannot afford it, or she may delay her mammogram and later on develop late-stage breast cancer. Surely, we cannot call her breast cancer just a choice. Just because patients' behavioral choices play important roles does not mean that the condition cannot be called a disease. No matter whether we approve of a patient's choices or not, our obligations to treat the patient with dignity, care, and compassion remain undiminished. Choices and diseases are not either-or propositions. It's not either a choice or a disease. Choices exist. However, the element of choice does not prove that addiction is not a disease. If addiction is not a disease, then neither are COPD, diabetes, lung cancer, or any of the other medical diseases for which patients' choices play a big role. Thank you for watching.